Well, in healthcare, the biggest challenges in healthcare and data collection is the fact that there is no consistency among the people that are putting the data in, and there's no consistency in the level of the persons putting the data in. So it depends on the nature of the data, and it depends on the importance of the data to the person entering it as to how accurate it is. So the challenge really is capturing data. And particularly at this point in time, we're interested in capturing as much data as we possibly can, and human input of that data is the most expensive. I think there are two answers to that question. One is to have the right idea, the right intuition as to what the content of that data might be, so that you ask the right questions from the data. And the other approach is doing something that's general enough that you're looking at the data without a bias as to what it means, and trying to use techniques that will let the informational content of that data show itself. Well, I think the answer to your question about how to communicate the results is really still a research issue. Traditionally, we've produced results in spreadsheet. I think that's not a very good way of producing a large amount of data, and we're looking for new ways of doing that, including ways of data presentation. And I think the answer to it is we have to understand more specifically what's behind the questions that's being asked in order to know the way to present the results of a query. The traditional ways that we now are doing are template-driven input. So we give you a drop-down list, and you pick from that, and we show you the elements that we're trying to collect. I think ultimately, increasingly, we will collect data with sensors. And my goal is any piece of data that I want to collect ultimately will be smart enough to have a sensor for it. So the more and more data we can capture automatically, the more accurate it would be, and the more consistent it will be.